The Guam Memorial Hospital's phones and electronic health record system is back online after it was disrupted from power fluctuations last week. The July 28th incident and following glitches over the weekend impacted billing and patient data access. Hospital Administrator Lillian Perez-Posada says adapting has been a challenge.
Patient registration and the billing system was impacted. And so we had to do again manual registering of the patients' names, where they're at, what room they're in, what kind of orders that the doctors want, what kind of medications that the doctors want these patients to receive. So all of that was being done manually.
When a hospital's EHR system is down, it leaves hospital staff unable to access critical patient information and can significantly hinder patient care. The public hospital's IT team has rolled out a cyber breach, but GMH needs to harden its IT infrastructure and upgrade multiple packages of software to include purchasing a new EHR system.
There's no indication that there were data breaches or any external, attacks. It was really just our internal infrastructure, our equipment, and the power sources. We are loaded with patient information, vital, critical patient information. And so, yes, across the nation, hospitals have been, a targeted source for all that information. And so it is our responsibility to make sure that we protect, the patient health information and even employees' information, their social security and all other vital information that, are in our system.
The current system, CareView, was recently implemented in late 2022 for $5 million, but later discovered to be unfit for a critical care hospital. GMH IT Administrator Manny Gabriel breaks it down further.
For example, the EHR, which is CareView, is only 3 years old if you think about it, but it interfaces with systems that are over 20 years old. And if the system is 20 years old, that means the software and the hardware is over 20 years old. And we have been able to get by basically with duct tape and band-aids for a while now, but it's not sustainable.
The much-needed upgrades are part of a risk management plan that GMH has to implement after being hit by cybersecurity threats in the last handful of years. One in March 2023 forced GMH to temporarily shut down their network, prompting the FBI and Homeland Security to get involved. As reported, 2 former employees accessed the hospital's network without permission from the U.S. mainland. That incident, along with a separate ransomware attack in January of 2019, led to a $25,000 fine from the U.S. Department of Health and Human Services for potential HIPAA violations and for GMH to come up with that risk management plan.
It's a 5-year implementation plan that's going to cost us about maybe $6 million a year. So definitely budget is critical for us to get. And I'm defending our budget with the legislature.
It should be noted a failing EHR system could also impact accreditation with the Centers for Medicare and Medicaid Services and could result in funding loss.
We don't want to lose the benefits, the reimbursement, and plus we want to make sure that we adhere and we comply to the standards of care that our team are giving the best and the most quality and safe care that they can, given the resources that we have, and that's really what the team spirit is within this hospital.
So far, as a contingency plan against future power fluctuations, GMH has procured 2 batteries as a power source, costing $59,000 each, which are still on their way to Guam by ship from Australia. Meantime, the hospital is to put out an RFP for a new record system, which could cost up to $60 million. Itsuki Hirayama, KUAM News.